Here is a step-by-step guide for performing a cardiovascular assessment. Preparation. Introduce yourself to the patient and ensure privacy. Explain the procedure to the patient. Confirm the patient's identity using two identifiers. Example, name and date of birth. Gather necessary equipment: stethoscope, blood pressure cuff, pulse oximeter, and a watch with a second hand. Patient interview. Obtain a thorough health history, including any cardiovascular-related symptoms, chest pain, shortness of breath, fatigue, etc. Ask about risk factors such as smoking, family history of heart disease, diet, and exercise habits. Inspection. Observe the patient for signs of cardiovascular issues. Assess skin color and check for pallor or cyanosis. Inspect the chest for pulsations. Clubbing of fingers may indicate chronic hypoxia. Jugular venous distension, JVD. Assess for JVD while the patient is at a 45-degree angle. Palpation. Palpate the peripheral pulses: carotid, brachial, radial, femoral, popliteal, posterior tibial, dorsalis pedis, for rate, rhythm, and strength. Check for capillary refill time in the nail beds. Assess for any lifts, heaves, tenderness, or masses in the chest. Palpate upper and lower extremities for edema, pain, warmth, and erythema. Palpate the point of maximum impulse, PMI. Auscultation. Use a stethoscope to listen to heart sounds at the 5 cardiac areas: aortic, pulmonic, Erb's point, tricuspid, and mitral. Listen for S1 and S2, lub, dub. Listen for any abnormal heart sounds: S3, S4, murmurs, clicks, rubs. Using the bell of the stethoscope, listen to the carotid arteries for bruits. Special tests. Perform an ECG, electrocardiogram, to assess the electrical activity of the heart. Consider additional tests based on the patient's symptoms and risk factors, such as stress testing, echocardiogram, or cardiac catheterization. Documentation. Record all findings in the patient's medical record, including vital signs, inspection, palpation, and auscultation results. Note any abnormalities and report them to the healthcare provider